we've talked about the left side of the chart, and I know that's a lot of information. We talked about staying with original Medicare, so you can have that freedom of choice of your doctors, your hospitals, healthcare providers, and filling in the gaps with a Medigap policy or Medicare supplement plan that you have options A through N, and looking at getting a standalone Part D plan. The other option that you'll have is on the other side of the chart, known as Medicare Advantage plans or Medicare health plans. You'll also hear it called Medicare Part C. These are health insurance plan options run by Medicare approved private insurance companies. Medicare Advantage plans are a similar way to get your Medicare covered benefits and services like your Medicare Part A and B or your original Medicare. Again, as stated earlier, you need to know because a lot of Medicare Advantage plans will already have their own Part D plan built into it, and some may even include some extra benefits that you might not find on original Medicare and might have those at an extra cost as well. But when you have a Medicare Advantage plan, I gotta stress, you do not lose your Medicare Parts A and B. Some people think that if they go this route, they've lost their original Medicare. I like to tell people you put it on the shelf. Go back to that red, white, and blue Medicare card that if you haven't gotten the mail, it should be on its way. When you have original Medicare and you go see a doctor, that's your primary insurance card. If you have a supplement or a Medigap plan, that's your secondary insurance. Well, if you go the Medicare Advantage route, you're not going to show your red, white, and blue Medicare card. And the reason for that is Medicare is actually subsidizing or paying these private insurance companies and their approved plans to handle all of your billing. So again, you're not going to lose your original Medicare because you're still going to pay, in most cases, your Part B premium when you go to the Medicare Advantage side. But you're going to utilize that private insurance company's insurance, meaning you're going to follow their rules, you're going to pay their co-pays, deductibles, and co-insurance for the plans that you pick. Three most common types of Medicare Advantage plans that you're going to run into, and I do have to stay quite broad on this, on the educational side of things, is because Medicare Advantage plans, a lot like your Part D, and what is available for you is going to be about what county you live in. And there are different plans that might be in one county of Texas and completely different in another county. So understanding what type of Medicare Advantage plan you're looking at, seeing what's available in your county, if this is the route that you're looking to go, can really help you understand what overall you're looking at. One option is going to be a health maintenance organization, also known as an HMO. Now with HMOs, most of the time you're going to find an overall lower out-of-pocket cost. And the main reason, in my opinion, is because you're going to be restricted to only using the plan's doctors, healthcare providers, hospitals to obtain the coverage. HMOs are designed to work with a certain group of healthcare providers. If you try to go outside that group, you're not going to have coverage. So this group of doctors that you use will allow the plan, knowing that these doctors have agreed to this type of coverage, to offer lower out-of-pockets, such be co-pays or co-insurance or maybe deductibles. But note that if you do try to use this insurance outside this group that you would have to use, or outside this HMO organization, you do not have coverage except for in the case of emergencies. Okay, HMOs are also plans that you really need to find out. Do you have to get referrals? In most cases you will, to see a specialist, and so they're going to keep you inside that network, inside that HMO, hence the reason for referrals. Good plans, low cost, just very restricted on doctors, healthcare providers, and hospitals that you may use. Might be a little too strict for you, so another option could be a preferred provider organization, also known as a PPO. Here in Texas, most people are very familiar with how PPOs work due to the major medical side. No matter private insurance or group insurance that you might have had through an employer, but a PPO is really where you choose from a list of doctors. And most people understand that, hey, if I go to a doctor in network, I'm going to get that lower copay, I'm going to get that lower deductible coinsurance. But if I go to a doctor outside of their network, I'm going to have to pay what is known as an out-of-network charge. With Medicare Advantage, it works the same way with most plans. If this is a true PPO you're looking at, you're going to have lower out-of-pockets in network, higher out-of-pockets out-of-network. But you got to throw in one more scenario. If the doctor, healthcare provider, or hospital is not willing to bill your PPO, that's not out-of-network. That's flat out, you don't have benefits. So how it would work with a Medicare Advantage plan is this. If the doctor's in network on your PPO, you're going to pay the in-network charges. If the doctor's out of network but is willing to bill the insurance company, meaning accept its terms and conditions and pay scale, then you're going to pay the out-of-network charges. But if that doctor tells you, no, sorry, we don't accept that insurance, you have no coverage. You're going to need to go find another physician in that scenario. Another option, also known as a private fee-for-service plan, or PFFS, about as similar to original Medicare that you can get when it comes to the not having a network. Private fee-for-service plans, there's not a group of doctors that you must see. There's no in-network or out-of-network charges. Basically, Medicare refers to it as an any willing doctor plan. So if this doctor, no matter where you're at, or if this healthcare provider or hospital is willing to bill the insurance company or accept the plan's terms and conditions or pay scale, you have coverage. And so this one's a little bit more broad. You might have to do a little bit more legwork to make sure that your doctors and healthcare providers, hospitals around your area accept the plan. But if they do, it takes a little bit of worry away from you when it comes to, is this doctor in network or out? If they're willing to bill, you have it. Now, with these plans, you have a little bit more broad area that you can choose, doctors, hospitals, healthcare providers, so on. But note your out-of-pockets. Your out-of-pockets could be higher. And again, a lot to absorb. I wish I could be more specific but there are so many different plans to choose from. Again, it's all about the county that you live in. We understand the terms. We can help explain this information to you. You can also find the plans at Medicare.gov. What are all the plans in my area? And reach out to us. Let us help explain the ins and outs. We can point you in the right direction. We can help you go. But ultimately, with Medicare Advantage, if you go this route, because this is the other option if you don't want to stay with original Medicare, just understand the rules. Understand your risks. And if you're okay with them, they're a great option for most people.